Hello and welcome to the Houston ISD Physical Therapy at Home website. Today I will be discussing safe lifting techniques, tips, and tricks. Tip number 1, always start with a wide base of support so your feet are apart and not together. Tip 2, you want to bend from your knees and not your back. So with that wide base of support, keep your chest up, tuck in your stomach, tuck under your pelvis, and sit back bending your knees. From the side, push your rear end out, bend the knees, and keep that nice curve in the spine here, and your head upright and your chest upright with good posture. This is compared to lifting like this. This is using your lower back. When you lift up, you're more at risk for injuring your back. So remember, bend with your knees, not your back. Tip number 3 is when you're moving, to make sure there's no twisting or very quick movements. If your feet are planted and you're twisting, you're at risk for hurting your knee or your back. So when we move with whoever we're lifting, we're gonna pick up our feet and move without any quick turns or twists. Tip number 4, when you're moving from one surface to another, for example, a wheelchair or a chair, you want to make sure that they're as close together as possible while leaving room for your body to be close to your student. If you have a wheelchair, you want to make sure that the brakes are locked on the wheelchair, and also you want to make sure that the surface they're moving to is stable and locked. Hello and welcome back to the Houston ISD Physical Therapy at Home webpage. Right now I'll be demonstrating a 2-person lift, moving from chair to chair. Now, if you're at home with a wheelchair, remember to lock the brakes and undo the straps before performing this move. There will be 2 people in this transfer, minus the student. And the first person that's at the top, there's a special technique to use in order to get them close to your body and performing a safe transfer. So you want to start with your wide base of support, your surfaces are close to each other, and you're bending your knees, not your back. I bend down and get my chest close to the student, and then I take my forearm, come underneath their arm, come with the other arm, and then I reach across to the opposite forearm and grab here and do a crisscross. This keeps her very safe and snug and secure toward my body and keeping her at my center of gravity. This way, she can't slip out with her shoulders, and I am not pulling on her arms, which could cause injury to her shoulder. So, down low, come in, crisscross, and you will lift this way. Now that is the top person's job. I'm gonna have her move right here so you can see from a different angle. But the second person is going to get the legs. You're not going to grab behind the knee or at the butt, but more the middle thigh. So again, you have a wide base of support, bending at the knees, not the back, coming down and getting underneath her thigh. And that person is going to lift with the first person. So, coming again, why don't you sit here? My second person will come. I'm going to stand over here. And when you're on a transferring team, you want to come up with a plan before moving the child. So we've come up with a plan to lift after the count of 3. So we'll go 1, 2, 3, lift. That way our movements synchronize with each other. We're not lifting at different times. You can pick one person to be in charge of counting, or you can empower the student to count, and we will lift once she counts to 1, 2, 3. Can you count to 1, 2, 3? Okay. So I'm going to come here. I'm going to make sure there's room, nothing in my area that I could trip over. Bending at the knees, not the back. His hands are under her thighs, and count loud and proud.
1, 2, 3.
Lift. And we walk over and not twist. Now we're going to do it on the way back so you can see it from a different angle. So get your arms in position. Wait. Is everybody ready? Okay.
1, 2, 3.
Lift. And lower. And that is a safe 2-person transfer. Just with anything, all of our students are unique. They might have different things that need to be considered when lifting, so please reach out to your physical therapist for specific tips and tricks on lifting your student. This is just a generalization. Thank you very much. Hello and welcome to the Houston ISD Physical Therapy at Home website. Today I'll be demonstrating how to lift a student from the floor to the chair. There are 2 different ways to do this transfer. You can do it doing a 1-person lift or using a 2-person lift. As with all of our students, they all have their own unique needs. So we recommend that you consult with your school-based physical therapist on what is the best way to lift your student off the floor. These are just general suggestions. Now, for a 1-person lift, we would recommend that the student not weigh more than 30 to 40 pounds. After weighing more than 40 pounds, then we would recommend a 2-person lift if possible. So for the 1-person lift, the student can start laying flat on their back. You come down to the ground, and you're going to help lift the student into a seated, supported position. Be careful not to pull on the student's arms to lift them up, but we want to use the forearm here to support the back of the shoulders and the head and neck if needed, if they have poor neck or head control. So I'm going to lean forward, bring my forearm underneath, take my hand on the opposite shoulder, and that way I'm also supporting their head or neck. Then I'm going to lift her into a seated position. Okay. Next, I'm going to take my stronger leg, which is my right leg, put it up to kneeling. I'm going to then take this arm, take my forearm, come underneath her middle thigh, not her knees or her butt, and kind of start to cradle her. I'm going to come close to her so she has her gravity near my center of gravity. I'm going to lift her onto the top of my knee. 1, 2, 3, up. And then one more time, I'm going to stand up. 1, 2, 3, up. And then one big step, bend my knees, not my back, and lower her into the chair. Now remember, when you are transferring from one area to the other, especially if you have a wheelchair, you want to make sure your brakes are locked, that the chair or other surface is very close to where you are transferring. So bring the chair to where the student is and make sure there's no obstacles in your path. Now we will demonstrate a 2-person lift. As we said before, this would be for the child that weighs more than 40 pounds, or even if they weigh 30 to 40 pounds but feel heavier than that, or you feel that you are not capable of lifting that much weight. 2-person lift is always the most recommended and more safe option. So I'm going to go ahead and put your head on the blue spot. Sweep down. So as demonstrated in previous videos, there will be 1 person at the head and another person at the legs for a 2-person lift. Similar principle to the 1-person lift is you're going to get the student into a seated position. So the top person can come down, bending at the knees. You can get comfortable this way, or you can come down here, but you will have to get back into this position to stand up. So I'm not going to pull on her arms or her head and neck, but I'm going to come back and support her head and neck here and push from her back shoulder blades. Then I'm going to bring her close to my body, right at the chest, to get her in my center of gravity. I'm going to take this arm, the forearm, come underneath into her armpit. Do the same on the other side, and do the crisscross method, which we talked about before. I'm going to grab the opposite forearm with my opposite hand. Now, the second person comes in, bends with their knees, not their back, comes down, gets close, puts their hands underneath the mid-thigh, not the knee or the rear end. Get a little closer. And we will do the same method of lifting, where one person counts and we all agree that we will lift after the count of 3. This is where you can empower your student to lead the lifting by allowing them to count if possible. Count. A little louder.
1, 2, 3.
Lift. The chair is closed. Turn her this way. Bend the knees and lower. And that is the 2-person lift. Again, once you get them in the chair, don't forget to put their seat belts. And good luck with lifting. Thanks.
Stinky Einstein.
Hello and welcome to the Houston ISD Physical Therapy at Home webpage. Today I'll be demonstrating how to help a student get off the floor into standing position. Now, this is assuming that the student has fairly good balance and trunk control and leg strength in order to stand up from the floor using one leg at a time. So if the student's down on the back, you're going to have them come to either a sitting position or roll onto hands and knees. You're going to have them come, just the tall kneel. You're going to have them come into a tall kneel position, that's the knees up. If they need a little support at the trunk, put your hands here. We're never going to be grabbing and pulling from the arms because that could hurt their elbow or shoulder. So you support them at the trunk. Now, you're going to take one leg and put your foot on the ground with the knee up. I would encourage you to have your student use their leg that they feel strongest with. So if it's their right leg or left leg, use the leg that's stronger because it's going to help them stand up better. And then on the count of 3, you're going to stand up. 1, 2, 3. Up. And that's it.